السلام عليكم ورحمة الله تعالى وبركاته. Let's move to the forearm. Forearm divided into two compartments, anterior compartment and posterior compartment. The anterior compartment of the forearm the muscle here divided into three layers: superficial layer, middle layer, and deep layer. The superficial layer contains four muscles, which are pronator teres, flexor carpi radialis, palmaris longus, flexor carpi annaris. Use your hand and put the thumb behind the medial epicondyle, and this forefinger donate the muscle pronator teres, flexor carpi radialis, palmaris longus, flexor carpi annaris. All these muscles originate from the common flexor origin, which locate in front of the medial epicondyle. In addition to that, pronator teres has another head known as a deep head, originate from the coronoid process of the ulna, and flexor carpi annaris also originate from the olecranon and posterior border of radius. So this is a general the origin. The insertion of this muscle is very important because by the insertion you can identify the muscle. For example, pronator teres inserted into the shaft in the middle of the lateral surface of the shaft of the radius. Flexor carpi radialis inserted in the base of the second metacarpal. Palmaris longus inserted in the apex of the palmar aponeurosis. Flexor carpi annaris inserted in the pisiform and in the base of the fifth metacarpal bone. Okay. Nerve supplied later. The action. From their name, pronator teres make pronation. Flexor carpi radialis flexed and abduct the hand. Palmaris longus tense the palmar aponeurosis and assist in flexion of the wrist. Flexor carpi annaris flexed and abduct the hand. In addition to that, this muscle originates from the front of the medial epicondyle, so it crosses the elbow, so also assist in the flexion of the elbow joint. So this muscle make flexion of the elbow, flexion of the wrist joint. So any muscles that end with annaris produce abduction, and that end with radialis produce abduction of the hand. Okay. In the intermediate layer, we have muscles that has four tendons, which is flexor digitorum superficialis. This one is flexor digitorum superficialis. The insertion of this muscle very important, which is inserted in the shaft of the lateral four digits. So this muscle produce flexion of the wrist and also produce flexion at metacarpophalangeal joint and proximal interphalangeal joint. Okay. In the deep layer, we have three muscles, which are flexor digitorum profundus, flexor pollicis longus, pronator teres. One medial muscle, one lateral muscle, and the third one located inferior. The medial muscle is flexor digitorum profundus. The lateral one, flexor pollicis longus, and the inferior one is pronator quadratus. The insertion of this muscle again very important. Flexor digitorum profundus inserted in the base of the distal phalanx, so it produces flexion of the distal interphalangeal joint. So the muscles that produce flexion at distal interphalangeal joint is flexor digitorum profundus. The muscles that produce flexion at proximal interphalangeal joint is flexor digitorum superficialis. Okay. Pronator quadratus originate from the distal part of the ulna to the distal part of the radius. Their action is pronation. Okay. Innervation. All the muscle in the anterior compartment of forearm supplied by median nerve, except 1.5 muscle that innervated by unknown nerve. The 1.5 muscle is flexor carpi and naris and medial half of flexor digitorum profundus, which is supplied by unknown nerve.